Welcome to Cannabis Health and Safety Concerns. Learning objectives. Cannabis poses certain risks to the health and safety of some consumers and others, especially if the consumer fails to use responsibly. Some of the more common short-term and long-term adverse effects of cannabis are mentioned in this training to call your attention to the potential downside of using or abusing it. Cannabis consumption can produce a number of undesirable effects that arise particularly when the concentration of tetrahydrocannabinol or THC is high and the consumer consumes too much. These effects are transitory, so they go away over time, assuming the person stops consuming for several hours. Long-term health problems related to cannabis are typically associated with continuous heavy usage over months or years. Continuous heavy consumption of cannabis also has the potential to cause problems beyond health issues, including increased absences and poor performance at work or school, relationship issues, and decreased satisfaction with life in general for some individuals. With rights come responsibilities. Even in areas where cannabis is legal, you're expected and legally obligated to consume responsibly for the health and safety of yourself and others. Being a responsible consumer means no mixing cannabis with other drugs, medications, or psychoactive substances, using in moderation, making rational decisions, and staying home or getting a designated driver when you're high. Plan to become high. Learning objectives. Cannabis overview. Immediate health effect. Cannabis impairment. Overconsumption symptoms. Cannabis addiction. Impairment safety tips. Smoking and secondhand smoking. Using cannabis during pregnancy. Safe storage. Edibles safety. Mixing other substances. Responsible cannabis use. Cannabis overview. From edibles to vaping and lotions to concentrates, there are many different ways to use cannabis, and each one affects people differently. No matter how you use responsibly. Smoking. Cannabis can be smoked using a joint, pipe, or bong, and this is the most common way people use cannabis. Vaping. Vaporizers heat cannabis to release tetrahydrocannabinol, or THC, the active ingredient in cannabis, and the vapor is inhaled. Vape products can contain nicotine, cannabis, THC, or cannabidiol, or CBD, or other substances like flavoring agents or additional chemicals. While vaping products have grown in popularity, we have seen outbreaks of lung illnesses linked to vaping. The long-term health effects of vaping are unknown, and as information on the illness emerges, our best advice is not to vape at all. Dabbing or hash oil. THC extract from cannabis, also called hash oil, shatter, or concentrates, can contain up to 60 to 80% THC and may take effect very quickly. When dabbing, the oil is heated and the vapor is inhaled. We don't know much about how safe dabbing is, but we do know that it's extremely potent and shouldn't be used by anyone who hasn't used cannabis before. Edibles. The effects of edibles, teas, and sodas can take longer to peak and last longer than smoking. Sometimes this can cause people to take too much. It can take up to 4 hours to feel the full effects, and effects can last up to 10 hours. A serving size is 10 milligrams, so don't start with more than that. Topicals. Infused lotions, salves, and balms are sold for localized pain and inflammation related to skin problems or pain, but do not make the user feel high. Know how to tell if something has THC in it. Government laws require all cannabis products to include the universal caution symbol on the packaging and on edible products themselves. Make sure you and your guests are familiar with this symbol to ensure no one accidentally ingests cannabis. Teach your kids not to eat or drink anything with this symbol, and always keep cannabis locked up, out of sight, and out of reach. Cannabis and your health. There's still a lot to learn about the effects of cannabis, but here's what we do know. Lungs. Smoke irritates the lungs. People who smoke cannabis daily or near daily may have a daily cough, bronchitis, mucus, and wheezing. Cannabis smoke contains the same cancer-causing chemicals as tobacco smoke. Heavy cannabis smoking has been linked with tissue damage in the lungs, although we need more research to determine if this tissue damage increases the chances of developing lung cancer. Mental health. Daily or near-daily use of cannabis can have a negative effect on your memory. Cannabis, especially in high doses, can cause hallucinations, paranoia, and not knowing what's real. Secondhand smoke. Secondhand smoke from cannabis has many of the same cancer-causing chemicals as secondhand smoke from tobacco. Never smoke around children, pregnant women, or anyone who doesn't want to be exposed to secondhand smoke. Youth. Youth who use cannabis regularly are more likely to have difficulty learning, memory issues, and lower math and reading scores. Immediate health effects. The effects of cannabis use can be different for everyone. Common effects may include a happy, relaxed, or high feeling, slower hand or eye coordination and reactions, distorted time and distance perceptions, trouble thinking, learning, and remembering, anxiety, panic, or paranoia, faster heart rate, increased blood pressure, less interest in normal activities, increased appetite, dry mouth, red eye, psychosis, seeing or hearing things that aren't real. This is more common with higher doses of tetrahydrocannabinol, or THC. These effects typically last 2 to 4 hours after cannabis is smoked or inhaled. When cannabis is eaten, the effects take longer to start and may last 4 to 10 hours. Cannabis can vary in its potency or strength depending on the plant and extraction process. Impairment. For occasional users, using 10 milligrams or more of tetrahydrocannabinol, or THC, is likely to cause impairment. This impacts your ability to drive, bike, or perform other safety-sensitive activities. People may think that they're safer drivers while stoned since they drive more slowly. However, research shows that driving while high may increase your risk of a crash. If you're high, you shouldn't drive, bike, or operate machinery. Smoking. Wait at least 6 hours after smoking up to 35 milligrams of THC before driving or biking. If you've smoked more than 35 milligrams, wait longer. Eating or drinking. Wait at least 8 hours after eating or drinking up to 18 milligrams of THC before driving or biking. If you've consumed more than 18 milligrams, wait longer. These times are estimates based on research findings. If you're unsure how cannabis will affect you, make other plans for transportation or don't drive. Multiple substances. Using alcohol and cannabis at the same time is likely to result in greater impairment than either one alone. Vaping. Vape products can contain nicotine, cannabis, THC or cannabidiol or CBD, or other substances like flavoring agents or additional chemicals. While vaping products have grown in popularity, we have seen outbreaks of lung illnesses linked to vaping. The long-term health effects of vaping are unknown, and as information on the illness emerges, our best advice is not to vape at all. Cannabis overconsumption. The symptoms of using too much cannabis are similar to the typical effects of using cannabis but more severe, and these symptoms may include extreme confusion, anxiety, panic, or paranoia, fast heart rate, hallucinations or delusions, increased blood pressure, severe nausea and vomiting. Increasing numbers of people are going to the emergency room after using cannabis, possibly because they used too much. This may happen because they thought a cannabis product was regular food, used a product with more tetrahydrocannabinol or THC than they thought, either because they're using cannabis for the first time or trying a high THC product. Consumed homemade edibles without a clear understanding of the THC content. Consumed more cannabis edibles than they needed since they didn't feel the effects right away. The effects of cannabis edibles may take up to 4 hours to peak after ingesting. If you or someone you know has any of the symptoms above, call medical services expert help anytime, and if the symptoms are severe, call emergency services or go to an emergency room. Long-term health effects. Research has shown that long-term use of cannabis can cause respiratory effects. Cannabis smoke irritates the lungs. People who smoke cannabis daily or near daily may have a daily cough, bronchitis, mucus, and wheezing. Both first-hand and second-hand smoke contain the same cancer-causing chemicals as tobacco smoke. Vape products can contain nicotine, cannabis, tetrahydrocannabinol or THC, or cannabidiol or CBD, or other substances like flavoring agents or additional chemicals. While vaping products have grown in popularity, we have seen the outbreaks of lung illnesses linked to vaping. The long-term health effects of vaping are unknown, and as information on the illness emerges, our best advice is to not vape at all. Lung cancer. There is conflicting research about smoking cannabis and lung cancer. The cancer-causing chemicals in tobacco smoke are also in cannabis smoke. People who smoke cannabis daily or near daily may have tissue damage in the airways of their lungs. More research is needed to determine if this tissue damage increases the likelihood of developing lung cancer. Brain and mental health effects. Heavy use of cannabis can damage your memory. This damage can last a week or more after the last time you used it. Cannabis, especially in high doses, can cause temporary psychosis, not knowing what is real, hallucinations, and paranoia, while you are high. Cannabis impairment safety tips. Being high or buzzed while doing some activities can be risky. For occasional users, smoking, eating, or drinking even one serving, 10 milligrams, of cannabis is likely to cause impairment. This affects your ability to drive, bike, or perform other safety-sensitive activities. Being high while caring for a baby isn't safe, so don't let anyone who's high take care of your baby. If you plan to use cannabis, make sure there's another person around who's not using it and can safely care for your children. Some cannabis can make people feel very sleepy when they're high. Cannabis makes you sleep harder. It's not safe for your baby to sleep with you, especially if you're high. It's not safe to drive a car while high, so don't let yourself or a loved one ride in a car if the driver is high. Ask your cannabis retailer for more information if you're not sure about how to use a product safely and responsibly. Getting help after using too much. Eating or drinking too much cannabis can make people very sick. They may have problems walking or sitting up, have a hard time breathing, or start to feel sleepy. Adults may become very paranoid and seem to lose touch with reality. If you're worried about someone, call emergency services as soon as possible. Calling is free and you'll be helped quickly. If a reaction seems bad, go to an emergency room right away. Calling for help in case of any drug or alcohol emergency can save lives. Stay with the person having the reaction and cooperate with law enforcement as well as emergency medical responders. Cannabis edibles safety tips. Although smoking cannabis has the added risk of harmful smoke exposure, eating or drinking cannabis still exposes you to tetrahydrocannabinol, or THC, the chemical that makes you high. All edible retail cannabis products must have clear single servings of 10 milligrams THC with no more than 100 milligrams per product. THC can affect people differently, so be aware of the amount you consume and its impairing effects. If you aren't sure how cannabis will affect you, ingest less than one serving and wait for at least 90 minutes and up to 4 hours before eating or drinking more. Start slow. A single 10 milligram serving of THC will likely hurt your ability to drive, bike, or do other activities, especially for occasional users. Use caution when consuming more than one serving. Wait until you feel the effect before using more. While you quickly feel the effects of smoked or vaped cannabis, edibles can require up to 4 hours to take full effect. Start with less than one serving and wait before using more. Always store your cannabis products safely. There's no better way to guarantee safety when putting cannabis in food. You can reduce the risk of bacteria and viruses by following safe food handling practices and good hand washing. Training will help cannabis product manufacturers learn the basics of safe food handling, similar to the education provided to anyone working in the food industry. This training doesn't address potency, the effects of cooking, or other production methods on potency or the amounts of THC within edible products. Hash oil safety tips. Hash oil, also known as butane hash oil or BHO, dabs, wax, earwax, honey, honey oil, or shatter, is a product created by extracting tetrahydrocannabinol or THC from the cannabis plant. This product may contain up to 80% THC and is consumed by smoking, vaporizing, dabbing, or adding to food. Consuming this highly concentrated form of THC increases the risk of an unpredictable high and negative physical and emotional reactions. Since dabbing only recently became relatively common, there's no reliable information on long-term health effects. Making hash oil using flammable liquids is extremely dangerous and illegal. It has resulted in explosions, severe burns, and death. There are safer ways to make hash oil. If you choose to use hash oil, we recommend buying it from a licensed cannabis retail store. If you choose to make your own, consider using dry ice or CO2 or ice water. These methods reduce the risk of fire and explosion. Responsible cannabis use. Responsible cannabis use is the only way to fly. So let's set the bar high and understand why we all have a responsibility in using cannabis safely and respectfully. The following are tips and advice. Before taking hits, remember the tips. Take it from experienced dispensary technicians. Responsible cannabis use is the only way to fly. So let's set the bar high and understand why we all have a responsibility in using cannabis safely and respectfully. Follow along for tips and advice. Don't ruin someone else's chill. People around you have a right to fresh air, so never light up in a public space. Not only is it against the law, but you're also exposing people to unwanted secondhand smoke. Definitely not cool. Instead, remember that it's perfectly legal to smoke in your own home or on your own property. Just keep in mind that property owners, landlords, and rental companies can ban the use and possession of cannabis on their premises. Consume edibles? Take it easy. Did you know it can take up to 4 hours for an edible to take effect? While it can be tempting to go in for another one while you're waiting for a high to hit, just chill out and have some patience. Using too much can lead to anxiety, hallucinations, and paranoia. Not a fun time. The standard serving size is 10 milligrams of tetrahydrocannabinol, or THC, so don't take more than that to start. Edibles can have a different effect depending on how often you use cannabis. Keeping cannabis safe. Kids, pets, or even curious visitors can get into cannabis if it's not locked up and out of sight. It's always best to keep cannabis in the child-resistant packaging from the retailer and invest in a safe or lockbox to ensure the only person who can get to your cannabis is you. Because even as your kids get older, it's important to keep your stash locked away safe and sound. If a child accidentally eats cannabis in any form, immediately contact a medical professional or call the local emergency services. You may know if someone has accidentally used cannabis if he has problems walking or sitting up, difficulty breathing, and becoming sleepy. If the reaction seems more severe, call medical services or go to an emergency room right away. Don't mix alcohol and cannabis. Using cannabis and alcohol at the same time can impair you more than using either one alone. It's never a good idea to use them together. Using alcohol and cannabis at the same time is more dangerous than using either alone. Use caution when driving, biking, or performing any other safety-sensitive activities after use of any form of cannabis, especially if you have also consumed alcohol. Be careful taking medication. Also, if you're taking prescription drugs, be sure to ask your doctor if it's safe to use cannabis. There may be drug interactions between cannabis and your medication. Talk to your healthcare provider about cannabis use if you're taking prescription medications. Don't test your limits. Whether you're trying cannabis for the first time or you're an old pro, there is such a thing as too much cannabis. That's why it's important to understand how cannabis affects you and know your limits. Signs that you've had too much can include extreme confusion, anxiety, paranoia, panic, fast heart rate, delusions or hallucinations, increased blood pressure, and severe nausea or vomiting. Not a good time. If you're new to cannabis and are unsure how it will affect you, start with a low dose. For edibles, a serving is 10 milligrams. Dabbing and hash oil products use highly concentrated tetrahydrocannabinol, or THC, with potency up to 80%, and shouldn't be used by anyone who hasn't used cannabis in the past. Never drive high. Driving while you're under the influence of cannabis is illegal and dangerous to yourself and others on the road. You can get in trouble by driving under the influence and are subject to the same penalties as driving drunk. Under most cannabis laws, you can't drive if you have 5 nanograms or more of tetrahydrocannabinol, or THC, in your system. Make the right choice by planning to wait several hours if you're going to drive. So, if you're smoking, wait 6 hours before driving. If you're having edibles, wait 8 hours. Keep cannabis where you bought it. Even though cannabis is nice and legal, it's totally illegal to take or mail it out of the legal jurisdiction where you bought it. Carrying cannabis is also banned at all airports, so if you're flying out of town, make sure you leave your cannabis at home. Sharing cannabis is not caring. Not only is sharing cannabis with people underage against the law, but it can also hurt their health, get them in trouble, and put their future goals at risk. You could be charged with a felony if you share with anyone underage, even if they're family members or friends. Safe and legal experience. If you're visiting somewhere where it is legal to use cannabis and plan to consume, follow the tips to make sure your good time is also a legal and safe experience. No laws. Adults can buy cannabis, and it's important to know the laws wherever you're located, and dispensaries, which are licensed retail locations, are the only legal places to purchase cannabis. So that means it's also illegal for you to resell cannabis. Read more about the local laws you need to know to safely, legally, and responsibly use cannabis. Locations. Before you use cannabis, find out if it's cool to use where you're staying. Many hotels don't allow cannabis on their property, so check with them first before using it because it could be illegal. Cannabis is also not allowed in any public space in government. If you're renting a car, know that it's illegal to drive high and to use cannabis in a vehicle, even as a passenger. Many rental companies may even charge a fee if the car smells like cannabis, and fees stink. Don't be that tourist. Even though cannabis is legal, it's illegal to take where it is not legal or mail it, so don't mess around, just keep it here. Carrying cannabis is also banned at all airports, so if you're visiting, make sure you have properly thrown away any cannabis before you leave. When getting rid of cannabis, use a secured container and place it in a safe place that's out of reach from children, like a dumpster. Never leave cannabis in hotel rooms or rental cars because you could be charged additional fees or it could fall into the hands of a minor. Cannabis addiction signs. Cannabis use can, in some cases, lead to addiction. This means a person can't control or stop cannabis use even though it interferes with daily life. Youth who begin using cannabis regularly are more likely to become addicted than those who wait until adulthood to use. It's important to know how to recognize when cannabis use is becoming too much. The Cannabis Use Disorder Test outlines the characteristics of addiction. The user may be stoned or high more than 1 to 2 hours per day on a regular basis, not be able to stop using cannabis once he or she starts, be stoned often enough that they fail to complete big tasks or commitments, begin to spend a great amount of time focused on buying, using, or recovering from cannabis use, have problems with concentration or memory loss, begin to take more risks while stoned, such as driving or caring for children, begin to talk about cutting back on their cannabis use, experience symptoms of withdrawal after not using cannabis for some time. One of these characteristics on its own may not indicate addiction, but the pattern of behaviors may signal a problem. Getting help. If you observe this pattern of behavior in yourself or in someone you love, get help. Learn all you can about cannabis use. Offering support and encouragement to your loved one is essential in finding the help he or she needs. Talk to a healthcare provider about your concerns. The right resource at the right time can put you or your loved one on the path to recovery. There's a network of substance abuse and mental health treatment providers who can support you on the road to well-being. Treatment is known to help those who are addicted. Talk to your and/or loved one's healthcare provider. Contact your medical provider to find behavioral health services nearby. Traveling and driving. Getting high before you drive can get you arrested for driving under the influence. This is true even though cannabis use is legal for adults. Similar to alcohol, there is an established impairment level for cannabis. By law, drivers with 5 nanograms of tetrahydrocannabinol, or THC, per milliliter of whole blood can be prosecuted driving under the influence. Even if cannabis is used medically, law enforcement can arrest you for impaired driving. No open containers. Neither drivers nor passengers are allowed to open any cannabis packaging and use the product while in a vehicle. You can be charged with a traffic offense if the cannabis product seal has been broken, some of the product has been consumed, and there's evidence that it was used in the car. Secondhand smoke. When using cannabis in your home, keep in mind that secondhand smoke, whether from tobacco or cannabis, can be dangerous. Make your home smoke-free to keep your loved ones healthy. Daily or near-daily cannabis smoking is strongly associated with chronic bronchitis, including chronic cough, sputum production, and wheezing. Cannabis smoke, both first-hand and second-hand, contains many of the same cancer-causing chemicals as tobacco smoke. Vaporizers heat cannabis to release its active ingredients, like tetrahydrocannabinol, or THC. They don't burn the plant. There hasn't been enough research to know if using a vaporizer is safer than smoking or if it's tied to breathing or lung issues. Secondhand smoke from cannabis has many of the same cancer-causing chemicals as smoke from tobacco. Protect your children and family from the effects of secondhand smoke. Don't allow anyone to smoke in your home. It's illegal to use any form of cannabis in a motor vehicle. Keeping your car smoke-free will keep you in compliance with the law and also protect your family and friends from the toxic effects of cannabis smoke. Exposure to secondhand cannabis smoke is unlikely to make you high. This means a person probably won't fail a workplace urine test or driving impairment blood test after breathing someone else's cannabis smoke. Youth and cannabis. There are many important moments in life that can shape your future. Moments where you find what you're passionate about, make new friends who care about the same things as you, and even earn the trust and freedom that come along with growing up. The decisions you make can help you get closer to the moments that matter most to you. That's why it's important to understand how using cannabis before you're of legal age can get in the way. The cannabis plant produces a mind-altering chemical called tetrahydrocannabinol, or THC, which makes you feel high. Cannabis can be smoked, vaped, or eaten in foods or drinks. All cannabis products are required to be labeled with a universal cannabis symbol, so always look for that. A lot of people think that since cannabis is legal, it's safe for anyone to use. That's not true, especially for those underage. Young people's brains aren't done developing until the age of 25, which means that using cannabis at a young age could get in the way of reaching your full potential. You're in charge of building your future, so take responsibility for knowing how cannabis can impact your health. Using cannabis could affect your brain's development, which can make it harder for you to go after your goals. The part of the brain that is responsible for making decisions is also affected when under the influence of cannabis. It can be harder for you to think clearly and avoid dangerous situations, like staying out of a car that's being driven by someone that is high or drunk. Youth who regularly use cannabis are more likely to have difficulty learning, memory issues, and lower math and reading scores. Studies show how these effects can last weeks after using cannabis. You need your brain for everything you do, from school to all of the other activities you enjoy. Do you want to let cannabis affect that? Cannabis prevention tips for youth. Cannabis can be addictive, and if you start using it at a young age, you're more likely to be addicted later. By choosing not to use, you won't need to worry about what cannabis could do to your future. Signs of addiction include letting cannabis get in the way of everyday life, like school, sports, or a job, using more or longer than you planned, and repeatedly trying to quit. Whether you're an artist or an athlete, you should know that cannabis can impact how well you do the things you like doing. That's because cannabis can affect your reaction time and coordination. This is particularly true when it comes to doing everyday things you love, like playing an instrument, skateboarding, and even driving. By not using cannabis, you can focus on the moments that matter most. Learn cannabis risks. Underage cannabis use can impact more than your health. From legal issues to how it can affect your plans after high school, knowing the risks can help you make the best decisions for your future. Underage use is illegal. Cannabis laws require you to be of legal age or older to use, buy, or have cannabis. But sometimes medical cannabis can be recommended to people underage who have a medical condition. If the person is underage, they can only get a medical card with doctor recommendations and parent or guardian approval. If you get caught using cannabis illegally, that includes using someone else's medical cannabis, you could cause you issues being a minor in possession. This is the case even if a friend or family member of legal age buys cannabis legally and then gives it to you. Plus, they could get in serious trouble for sharing it with you because it's illegal. Don't lose trust. If you get caught with cannabis, you can lose your parents' trust and the freedoms you worked hard to earn. Your friends could also feel disappointed or uncomfortable if they find out you're using cannabis. Don't let cannabis distract you. If you're caught using cannabis, it can seriously impact you at school. You can be kicked off sports teams and banned from extracurricular activities. And you can even be suspended, expelled, or referred to drug counseling. School is already stressful enough on its own, so to avoid losing things you love, don't use cannabis in the first place. Keep your record clean. Just like driving drunk, driving high is illegal. Not only could it land you issues with driving under the influence, but it could also seriously hurt you and other people on the road. Cannabis affects your reaction time, judgment, and depth perception, which makes it more dangerous to get behind the wheel. Legal fees are also expensive and can cost thousands of dollars in legal fees. You may also spend a lot of hours in court, which could lead to court-appointed community service, probation, or possibly even jail. Cannabis can affect college opportunities. If you get caught with cannabis underage, you can get in trouble being a minor in possession. Whether or not college is on your radar yet, a citation can result in the loss of federal financial aid, meaning you might not get the money you need when the time comes. This applies to a number of different types of financial aid. Your job. Drug testing is still common for many employers. Many companies do not allow cannabis use, so if you are caught with cannabis at your job or get caught driving under the influence or as a minor in possession, you could be fired. This could make it harder to be hired in the future. It's important to know that even if you haven't used cannabis for several weeks, tetrahydrocannabinol, or THC, can stay in your system. That means you can test positive even if you haven't used it recently. Your future. Life is already full of challenges. Whether you're focused on becoming more independent, learning a new hobby, planning for college, or helping your family, using cannabis can make achieving these goals even more challenging. So go out there, focus on what matters to you, and find your moment. Safe cannabis storage. Cannabis products can be mistaken for regular food or candy. Increasing numbers of children have been to an emergency room or hospitalized after accidentally consuming cannabis. Help prevent these accidents among children by storing your cannabis products safely and securely. Be sure to keep all cannabis products in child-resistant packaging, clearly labeled and locked up. Keep cannabis in the child-resistant packaging from the store. Make sure your child can't see or reach the locked cabinet or box. How you store cannabis should change as children get older. Safe storage around young children may not stop older children or teens. Recognizing cannabis products. The government will require that all retail cannabis products use a universal cannabis symbol on the packaging. Teach your kids not to eat or drink anything with this symbol on the package. Also, adults who can't read the ingredient label can use this symbol as a warning that the product contains cannabis. Accidental cannabis use. Eating or drinking cannabis can make children very sick. They may have problems walking or sitting up, have a hard time breathing, or start to feel sleepy. If you're worried about your child, call emergency services as soon as possible. Calling is free and you'll be helped quickly. If a reaction seems bad, go to an emergency room right away. Keeping pets safe. Store cannabis products safely to keep pets safe from accidentally eating marijuana. According to reports, veterinary hospitals are seeing an increase in the number of visits from pets that have eaten cannabis. Learn more about safe storage for tips on how to store cannabis to prevent youth and pet access. Call a veterinarian if you suspect your pet has ingested cannabis products. Cannabis use during pregnancy and breastfeeding. There's no known safe amount of cannabis use during pregnancy or while breastfeeding. Cannabis is now legal for adults, but this doesn't mean it's safe for pregnant or breastfeeding moms or babies. You shouldn't use cannabis while you're pregnant, just like you shouldn't use alcohol and tobacco. Talk to your doctor if you're pregnant or breastfeeding and need help to stop using cannabis. Talk to your doctor if you use cannabis for medical reasons. There are other, safer choices to treat medical problems during pregnancy. Using cannabis while pregnant may harm your baby. Cannabis smoke has many of the same chemicals as tobacco smoke. Some of these chemicals may cause cancer. Tetrahydrocannabinol, or THC, is the chemical in cannabis that makes you feel high. Using cannabis while you're pregnant passes THC to your baby. THC may make it hard for your child to pay attention and learn, especially as your child grows older. This would make it harder for your child to do well in school. Some people think that using a vape pen or eating cannabis, in cookies or brownies for example, is safer than smoking cannabis. Even though these forms don't have harmful smoke, they still contain THC. There may be legal consequences for using cannabis while pregnant. If you are pregnant or a mother with young children, you are a priority for drug and alcohol treatment. Treatment is available where your children are welcome. Your treatment will be confidential and non-judgmental. Thank you for viewing Cannabis Health and Safety Concerns.